What we know is that there are interventions that can be used years ahead of a child seeing a child psychiatrist. Most children, when they see a child psychiatrist, are in their teenager years. And by that time, they may have already suffered from significant mental health problems for 10 years or more. Parenting management training, that's a very well researched strategy that can be used with families with children as young as 2. Studies indicate that when parents use this intervention early, can decrease by 50% or more the chance of children developing oppositional defiant disorder, and can also decrease significantly children's anxiety problems. Unfortunately today, families can start attending this program for free online. There's a program from Dr. Kazdin available on Coursera that's really an amazing program, has been attended for over 200,000 people, and we're going to put the name of the program on the screen for you to register. You can start attending it today for free right away. The parenting book that I recommend the most often today for families is the book The Kazdin Method for Parenting the Defiant Child. It's also available as an audiobook. You can try to sign it out for free in a public library, or you can purchase in a bookstore for about $20 US. It's really an amazing book. There are families, they feel they need a guidance for a professional. For example, they can go online and on the PPP International website and look for a trained counselor from the PPP. PPP is an evidence-based parenting program that was developed in Australia. But we have certified trainers of the certified counselors from the PPP here in North America, both in the US and Canada. So you go to their website and look for a certified counselor from the PPP, and that counselor can give you individual guidance on how to create a program for your child, or can invite you to some group activities. The evidence-based parenting programs usually have one feature in common. They teach us how to focus on the good behaviors of children and try to not pay so much attention to their unwanted behaviors. So how Dr. Kazdin explained in his book is we have to give lots of attention to the opposite positive of the unwanted behaviors. Okay, let me explain that. Let's say, for example, a child is always running at home. So he's running inside the home, can bump into things, can break things into your home. That's the unwanted behavior. So the opposite positive of running in the home would be walking slowly. Okay. So we want you to give lots of attention to the opposite positive of running in the home. So whenever you see then your child walking slowly, you go there and say, "Oh, Johnny, thank you for walking slowly." Give a tap on the shoulder, be honest, so what you do, you describe what your child is doing it and give us praise instead of saying, "Oh, good job." So you describe to what you're doing, that's descriptive praise. If you do that at home frequently, your child is going to learn that skill. And what you know, the children will use the skills they will use the skill at school too. So use that same skill with their peers, and if they're using the skill with their peers, they have be more successful to create new friendships, keep the friendships. So again, the benefits multiply. So it's not just decrease the conflict at home. No, you're teaching better problem-solving skills that can be used at home and school, and will benefit the child because you have less conflict at home, but also less conflict at school because you have better social skills. What we know is for sure happen is when parents use their parenting programs, their children's self-esteem can improve. Yes, because if they feel more loved, better treated at home, and that's what the studies indicate. When parents use their parenting programs, the conflict at home decreases significantly. Children feel less criticized, and that has an immediate positive impact on their self-esteem. The self-esteem improves. They also feel more confident at school to talk with others. And when we teach the parenting program, we always tell the parents to involve the children in the program. For example, when you're going to do a reward program, then you will talk with your child to see what will be the rewards. Of course, you're not going to just give all your child's requests as a reward, but you involving your child, it become a joint activity. So we all learn together, and then when you're doing that, you're being more humble also with your child. Say, mommy or daddy is learning too, And this is an amazing teaching for your children that, yeah, we all should learn, we all can improve our own behaviors. And if your child is learning that early on, you're setting up a really good start for your child in his or her life. So a very common situation that happens is, so I recommend the parenting training for the parent who happen to be also a teacher, right? And the parent read a book, for example, the Kazdin Method, or attend the online program from Dr. Kazdin on Coursera that's available for free. And the families come back and say, oh, doctor, my child is not talking back to me anymore. My child is following my request right away. And then the child turned to me and say, oh, doctor, yes, things are so much better at home. We're getting along so much better. My mom is not yelling anymore. So, and frequently what the parents will tell me, that these parents that are teachers, right, say, oh, doctor, you know what? I'm using the program also at school and in my classroom, and things are going much better at the classroom too. The children in my school, my classroom, are more cooperative. I have seen situations even when the parents were principals and bought copies for the school. It's really amazing, you know, amazing what parenting training can do. Parenting training should be used by all the families, and can decrease the use of mental health services, because help children to avoid ever developing problems with oppositional behaviors like talking back to the parents, not following their request, or if the children already have these problems, can decrease these problems. Studies also indicate that when parents attend parenting programs, even the parents' mental health improve. If the parents are struggling with depression, they're more likely to overcome depression and anxiety problems, the parents themselves. Thank you for watching this video. There's a lot more to learn. I created a playlist for you here. You just click on the playlist. You can learn more about parenting training, about the self-help books we recommend for families. There's so much more to learn, so many amazing resources.